So, why is health insurance rising so much? We've had 3 years now of multiple increases in premiums every year. Families are seeing the cost of basic cover going up between 2 and €500 a year, and it seems as if it's going to keep happening. So, what exactly is going on here? Why are VHI, Leia Healthcare, and Irish Life Health, and even the new player, Level Health, they increase one of their plans? Why are they all increasing their cost of their cover? Well, it seems that Slaintecare has had something to do with it. Slaintecare is a reform of the public health system to create equal access to health services for everybody based on patient need rather than ability to pay. So it's an attempt to get away from the fact that more than 2.5 million people have health insurance in this country because they're afraid they won't get access to the system. But the problem is that Slaintecare means that more and more consultants are getting public-only contracts. In other words, they've ceased to do private work in public hospitals. This means that health insurers are having to rely on private hospitals, which are much more expensive. Combine that with growing demand for health care, and you get a situation where premiums keep going up. It's because fewer consultants are practicing private medicine. 64% of the new contracts now are public-only contracts for consultants. And so health insurers are having to go increasingly to private facilities, private clinics and private hospitals, which are far more expensive. And unfortunately, unless something changes here, this is just going to make health insurance more and more expensive. So it's interesting that Slaintecare, an attempt to create a kind of equal access public health system, is actually causing misery for the 48% of the population who have private health insurance.